Did you know that low libido affects 40% of women? I'm Dr. Rena Malik, board-certified urologist, sexual health expert, and medical advisor for FemHealth, your #1 source of evidence-based health information for you by doctors. Today, we are talking about treatments that are available for low libido. If you enjoy this video, be sure to subscribe so you don't miss our completely free content teaching you everything you need to know about women's health. All right. Low libido, also known as hypoactive sexual desire disorder, or HSDD, is relatively common. And while it affects up to 40% of women, only 12% are really bothered by it. In medicine, we describe this as having a lack of motivation for sexual activity. You may have decreased or absent spontaneous desire, which is thoughts or fantasies, or decreased or absent responsive desire to erotic cues or stimulation, or you're unable to maintain that desire or interest throughout sexual activity. It can also be a loss of desire to initiate or participate in sexual activity, in which case you might even avoid situations that lead to sexual activity. And the key is that it's combined with clinically significant personal distress like frustration, grief, guilt, sadness, or worry. Basically, you don't really feel motivated to or want to have or even think about sex, and it bothers you. But if it doesn't bother you and your relationship and your partner are fine with it, you don't need treatment. Everyone's individual libido is variable, and just because yours is different than someone else's doesn't mean it's a problem. If you're suffering from low libido, the first thing to identify is if it's caused by something else. Find the underlying problems. Often having chronic medical conditions like hypothyroidism, anemia, urinary incontinence, fecal incontinence, or pain throughout the body can make it very difficult to feel aroused. So treating those issues first can dramatically improve your desire. Additionally, there may be other conditions that you don't even know you have that can be identified by a doctor, like clitoral adhesions, pelvic floor dysfunction, or vaginal atrophy that all can contribute to low libido. Also, you want to check your medications. Certain medications like antidepressants, antipsychotics, or even in some cases, oral contraceptives can cause low libido. So changing those for alternative medications can often help. Lifestyle changes. Let's face it, life is busy and stressful, especially when you add in children or sick family members into the mix. Fatigue and stress are huge contributors to low libido. However, doing many of these changes are not always feasible for everyone because of financial constraints. If you can try, work on improving your sleep hygiene, get support for childcare or household duties, and try to add relaxation techniques to your daily routine, like meditation or yoga. Also, sometimes scheduling date night or even scheduling intimate time with your partner can help. Psychological therapy, including behavioral therapy, cognitive behavioral therapy, and mindfulness therapy can be helpful. Behavioral therapy uses techniques like communication skills and sensate focus. Cognitive behavioral therapy challenges unrealistic beliefs that might contribute to sexual problems and alter behaviors that maintain this low desire. Mindfulness-based CBT includes exercises that aim to cultivate a present moment awareness and a non-judgmental observation of experiences. Medications. There are 2 FDA-approved medications for the treatment of low libido and some off-label medications. Bremelanotide is an approved medication for premenopausal women with low libido. It's an injection that comes in an auto-injector similar to an EpiPen. You give it to yourself when you want, about 45 minutes before sexual activity. It has been shown to increase sexual desire in about 50 to 60% of women who try it. Side effects can commonly include nausea in about 40% of women who take it on the first injection and headache in 11%. Flibanserin is a medication taken once a night to help improve libido. It also works in about 50% of the women who take it, but it does require 8 weeks of treatment before you see effect. It's taken at night because one of the main side effects is feeling sleepy, and it shouldn't be taken within 2 hours of any alcohol because it can worsen that side effect and potentially cause low blood pressure. Off-label medications include testosterone for postmenopausal women. This is approved in Europe and Australia, but off-label in the United States. This is usually given as a gel or cream that is applied on the skin at about 1/10 of the dose that's given to men. This does require monitoring of testosterone levels, and there are risks of side effects like acne and hair growth. That's all for me. I hope you found this helpful. And if you enjoyed this content, make sure to subscribe and share this channel with your friends. The doctors of FemHealth are here for you and your family.